I was 29 years old when I started medical school. So I had been a nurse, like I said, for 5 years. And I used to do this thing where I would sit and write out my timeline with my age next to each next milestone and just thinking like, am I going to be okay with getting to this milestone, becoming and attending when I'm almost 40 years old?
Welcome to FemMD, real talk for women who are balancing careers, ambition, and the chaos that comes with it all. Today's guest is Dr. Lily Nguyen. She started out as a nurse and is now training to become a radiologist. Of all the people I've met in healthcare, she's the very first that I know that's gone from nursing to MD. Let's hear her story. How's life been? It's been a few months since we met.
Yeah, life has been like ups and downs. Honestly, I'm trying to adjust to my new life in Ohio. I moved across the country for residency. So I've just been trying to adjust to the Midwest. It's a different lifestyle out here. It's a different pace. I'm working with all new people and just trying to adjust.
Yeah, you got thrown into the deep end, I feel like is what residency feels like when you really weren't even taught how to swim.
Exactly. And it's a new specialty as well. So I did a year of, a transitional year. So I did mostly what I learned in medical school and as a radiology resident. I mean, all of it is just brand new. And I feel like I'm in another fire hydrant of learning. So it's been a lot.
Okay, so I was recounting every healthcare human I've met. I think you're the very first person I've met who practiced as a nurse for quite a while before deciding to go to medical school, and then you decided to become a radiologist. Walk us through kind of your journey.
Yeah, so my journey into nursing started a while ago. I started undergrad not really knowing what I wanted to do. I ended up taking some physiology courses and loved it and thought that the most practical thing was to be a nurse. I spent a lot of time with my sick dad in the hospital. I saw how the nurses and physicians treated him, and I was like, I want to be a part of the healthcare team. At the time, I did not have anybody in my family who's ever gone to medical school, so that didn't even cross my mind. I almost felt like it was completely out of reach for me academically, and I felt like nursing would be... Why?
Yeah. Why did you feel like it was out of reach?
I always felt like going to medical school and doing pre-med prerequisites felt very scary. Doing hard sciences was not something that I was very experienced in. I didn't know anyone in my family who had done healthcare. So all of that was very scary and daunting. So I felt like I needed to go and do something more straightforward, streamlined, doing nursing. And I can't even say that doing nursing was an easy task because getting a bachelor's degree in nursing was also difficult for me. And by the time that I did that, I loved being a nurse. I was a nurse in cardiology for 5 years. It was an excellent job that provided me a lot of work-life balance, and I was able to do some international volunteer work. And during that time, I kind of felt the limits of my degree. I saw the impact the physicians made, and I was just thinking like, that sounds like still out of reach for me and scary, but maybe something that is possible for me in the future. And it wasn't until I met another nurse, she happens to be one of my best friends, who told me that she was going to apply to medical school. And at the time, I thought she was absolutely insane. Like, why would you go through the difficulties of becoming a nurse just to go through even more difficult training to become a physician? But she showed me that it was possible. And sometimes that's all it takes, is that you see someone else do it and you think, okay, if they can do it, maybe it's possible for me to do it. And that's kind of when the doors opened for me, and I decided to go on that route.
Yeah, it's interesting because my two co-residents that I was with for 5 years, they both had kind of former careers. So to me, it's not really foreign at all. I also think that there's this like weird societal pressure for us to decide what we want to do when we're like 18 or 20 or 22. But really, it's like if you have phases of careers in your life, we're here on this planet for so long. So what age were you when you started medical school?
I can't agree with you more though, because I get a lot of questions about being a certain age and having that pressure to figure out what you need to do. I was 29 years old when I started medical school. So I had been a nurse, like I said, for 5 years. And I used to do this thing where I would sit and write out my timeline with my age next to each next milestone and just thinking like, am I going to be okay with getting to this milestone, becoming an attending when I'm almost 40 years old? Am I going to be okay with that? And I have to constantly remind myself, even today, I just turned 34 years old, that I'm going to be this age anyway. I'm going to be 40 someday anyway. Like, will I be okay with being where I was or at the next level of my training? Because I stuck it out and said, it's okay. Like, I don't need to follow society's construct of age and where I need to be in my life. I just need to go after what I truly want for myself. And in the end, I'm going to be that age anyway. So I need to be proud of what I've accomplished to that time. And it's all about the journey of getting there. It's not always about just getting there, because you just have to enjoy the whole process and be happy during the entire process. Because if you live in that mindset of, I will be happy when I finish medical school, when I finish residency, your goalpost will continue to get further and further away.
Oh, for sure. It's the arrival fallacy. If you
Exactly.
read about it, it's like, I'll be happy when, I'll be happy when, I'll be happy when. And I'm very much that way. I have to like force myself to try to be happy, like in the moment, enjoy things the way they are now, appreciate the hustle and the struggle.
Right.
Okay. So you decide to go to medical school. I would say probably the number one comment you get from nurses is like, why did you not become a nurse practitioner? Walk us through that.
Absolutely. That is one of the most common questions I get asked. So, becoming a nurse practitioner is the most streamlined next step after getting your RN. It can usually take a year to a year and a half. Sometimes if you want to get a doctorate in nursing practice, it'll take a little bit longer. So it's the most streamlined approach. Most of my nursing colleagues were NPs or were in the process of getting their NPs. And so I did a lot of soul searching. This was not an easy decision to make. I shadowed a bunch of nurse practitioners. One in particular stood out to me. She was a very experienced nurse practitioner who'd been in cardiology for decades and told me that she had wished she went to med school. If she was my age, that's what she would do. And at the time, it was because she felt like she was doing a lot of the work that, say, like the fellows were doing, and that she just wanted to push her education a little bit further to kind of increase her scope. That stuck with me. And then I realized that going to medical school would open the most amount of doors for me. So I wanted, if I was going to go and do graduate school and pursue this very difficult thing, I wanted to go the route that would give me the most amount of options. And when it came down to it, I would not have been able to become a diagnostic radiologist and train in residency to be a radiologist had I not gone to medical school. So, other doors that are open for me as a person with a medical degree is, becoming a surgeon, doing interventional radiology. So there are just certain specialties that you don't really have access to unless you get a medical degree. And so that kind of answered it for me.
Yeah, for sure. Okay, so let's talk about, from my perspective, you go from like bedside cardiology nursing to radiology, which arguably is one of like the furthest subspecialties away from bedside nursing. Is it because you just fell in love with radiology? Is it because you had a distaste in your mouth from like bedside nursing? Did you know when you went into medical school you were interested in radiology?
Yeah, I think that's a great question. I actually, it's funny because I kind of have like two different answers to this. First of all, I need to preface with the fact that in my nursing career, not only did I do bedside nursing, I also did, I was in a like a recovery area for cardiology and radiology services. So I prepped and recovered patients for their IR procedures. So that was an introduction to what radiology can do, that it wasn't all non-patient facing. So there's some aspects of radiology that is clinical, and that includes interventional radiology. So I had that experience as a nurse. I did that for 3 years. And then, so that was my introduction to radiology. But then as I went through medical school, what I initially thought was that to get fulfillment and reward from medicine, I had to be the most patient-facing as possible. So doing something like psychiatry, where I'm always talking to patients. So I actually went through medical school. I did 2 sub-Is in psychiatry. I presented at conferences. I went to multiple conferences in psychiatry and thought this is what I was going to do because I need to be as patient-facing as possible to get the most reward out of my job. And when I got to July of 4th year, I was just thinking like, I am not feeling what I thought I would get from this. And I had like an existential crisis and was like, I need to figure this out because residency applications are due in 2 months. And I spoke to a lot of people, and coincidentally, that best friend, she's going to come up again. She, the nurse that went and became a physician, she was a year ahead of me, had already matched into diagnostic radiology. So this is another nurse who's matched into radiology. And I had a heart-to-heart with her, and I felt like diagnostic radiology encompasses so much of medicine. Our job is literally to diagnose patients with their ailments. So whatever they're coming in with, what I'm learning right now during my rotations, people coming in with years of pain, and we get to give them an answer because we've imaged whatever area has been causing them these issues. And I can tell you, the last 6 months of your pain has been because of osteoarthritis. I see it. I can, for a fact, see it on your imaging and tell you and diagnose you with this. So that's kind of like my program director answer. Like this diagnostic radiology encompasses all of medicine. I get to, not give up any demographic of patients. We image everybody from young to old to pregnant. I don't have to give up any demographic. Now, if I can just give you an answer as a friend, radiology gives me the best lifestyle. I can work from home if I wanted to. I can work part-time if I wanted to because the salary is very high and money matters. I'm not going to pretend it doesn't. So there's so many factors that kind of went into that answer.
Yeah. So when we talk about, money matters if we take that. So you went from being a nurse, making a salary, to deciding to go to school for 4 years. You really can't work during medical school. Did you take out loans? And then ultimately you make quite a bit of money as a physician, but there's this huge delay.
Yes. So the financial aspects of a nurse with a full-on career deciding to go to medical school is definitely a consideration for anyone who's, making that decision. So when I decided to go, I knew that I was going to have to take out loans. Nearly every medical student does. And so I planned for it saving as a nurse. I worked a lot. I saved some money. I have a partner who works. So he was able to help support half of the bills. That was very helpful. And then I was very, very fortunate. I received a tuition scholarship from my school. So I think that there's this, the conversation around medical school funding often only highlights how much it costs to go to medical school and almost never highlights the amount of funding that is available for medical students. Often, full scholarships are given to people who want to go into primary care. The medical school that I went to, University of Arizona in Tucson, offers primary care scholarships, full scholarships, to people who want to become go into primary practice, internal medicine, even general surgery, full tuition scholarships. They offered me a full tuition scholarship. I was very fortunate for that. And that was all based on my secondary essays. So something that I also tell medical students not to sleep on is making sure that you write those genuinely and not sleep on those secondary statements, because it seems like so much goes into the application process. But that opportunity allowed me to kind of lessen my loan burden. I still had to take out loans for living expenses, but they're very manageable. And my goal is to pay off my loans during residency, especially with radiology residency allowing moonlighting.
So I will say in residency, I like as a surgical subspecialist, we would sometimes creep our way into the dark rooms of the radiology residents and say, hey, can you pull up the scan real quick and look through it with me? And I was like borderline envious of how like quiet and calm that whole area seemed when I had to like go back down to the ER and drain like pus from someone's head that was like screaming and drunk. But then I would see like your guys' queue of like how many scans you had to read. Talk about how like your first little bit of residency has been and kind of some of the stress points or challenges of a radiology resident.
Absolutely. Full disclosure, I've only been a radiology resident for this is going on 3 months.
That's okay.
And yeah, it's been very tough to transition into being a radiology resident. My first month, I was convinced that I was going to switch my specialty. I just felt so out of place. It was very strange to me to show up to work, spend 8 hours at work, and not see anybody or work with anybody or touch a patient. That was very odd to me. My entire career as a nurse, training through medical school, in my first year as an intern, I was always working with patients. And there's a lot of satisfaction in doing that. So that was very, very tough to adjust to. So it's funny that you say, it's so quiet in the reading room. Yes, it is very quiet, and almost too quiet. And the other aspects that like you just don't learn about or are exposed to in medical school is that, when you think of literally what you think of a radiologist, like just sitting at their desk, like the movement I get in my 8-hour day is standing when I turn my standing desk on to stand up, and then sitting down for the rest of the half of the day. So our movement is very minimal. There's not much moving around. The other thing I didn't realize about was the amount of pages we get the entire day. I thought that I was going to stop getting paged as much from intern year to becoming a radiology resident, but techs, so X-ray techs, MRI, CT techs, page radiology residents and radiologists all day long about protocols. So that's nonstop, and that kind of pulls you away from your studies that you're reading. And then, of course, the queue. So I started on neuroradiology. Our queue was 800 studies long. So it's almost like you'll never kind of catch up when the studies are that long. Mm-hmm. But I've also done musculoskeletal, so reading just plain films of bones, and we'll catch up on those lists. And that just ends up, sometimes you just have a very, very chill day. You read all morning, and then the afternoon, there's nothing on the queue until things show up as people are coming in and getting scanned. And then I started to learn to get the satisfaction from that, because I have to put myself in the patient's shoes. They're coming in for a study. They get scanned, and within the next hour, they will have their final report in their MyChart. And there's a satisfaction in that, because we're answering questions for them, and I feel like if we can do that quickly, I feel good about that.
Yeah, for sure. I just as a side note, I developed some pulsatile tinnitus postpartum with my first child. I was still in residency. That's like when you can like hear this like whooshing in your ear. And I had convinced myself that during pregnancy, I had formed like a AVM in my head and was going to die. And anyways, one of my attendings ordered a brain MRI, and they asked me like, are you going to be nervous to like lay in this tube for an hour? And I was like, no, I'm actually very much looking forward to like laying down for a full hour, and my pager cannot be next to me.
Right.
It was like a very relaxing hour for me. And I was like, wow, this just shows me like how different my life is from like my friends who are not in medicine right now, who would be probably a little apprehensive about laying in this machine for an hour. But do
Absolutely.
you, when you talk about like the techs and helping kind of some of the other team members within the radiology department, how do you guys approach the more anxious patients that need sedation or children that have big, long studies that have to sit still? Do you assist with any of that yet? Or is that more of an interventionalist job?
I have not done much patient facing stuff. Even the protocoling isn't an R1's job. So, our job as an R1 in our first year of radiology training is to learn as much as possible and get ready for call. And that's basically my job right now. It's a wonderful job because my passion is learning. So my job every single day, showing up to work and learning anatomy and getting down normal anatomy as much as possible before I try to diagnose like pathology. Now, when it comes to protocoling and dealing with anxious patients, this is typically more of the upper levels or when we're on more patient-facing rotations like interventional radiology, which is also something they don't put R1s in until the second half of our first year. And so, I mean, I'll learn more about that then. Now, from what I can remember as a nurse, since I helped with that for interventional radiology, often those IR procedures are done under moderate sedation. And for children, it's done under GA. So I know that there are ways to help with the procedural side of things. As far as just like getting the scans done, I'm not too sure how they get that done yet.
That's fair. So let's transition a bit into the mean girl culture in medicine. You know, I think I see a ton of videos online about like nurse on nurse meanness. I think certainly as like a young female in surgery, I experienced some like weird scenarios where I was like, why are you being so mean to me? Like, I'm just here doing my job. Talk a little bit about your experience with kind of being a woman in nursing, a woman in medicine, and also being a minority.
Yeah, absolutely. So, overall, I have felt a lot of camaraderie, especially when I was a nurse. I do feel like being a physician, because you're in a position of leadership, the camaraderie ends up being kind of just between you and the residents. And it was rare that I felt that like between me and other nurses. Now, there were exceptions to that. During my intern year, I felt very close with like the ICU nurses I worked with because I relied so heavily on them to help me. But mostly it was because like we as physicians are trying to communicate orders. As a nurse, nurses take those orders and they actually act them out. So those are the kind of tasks that need to happen. I had an incident during my intern year. I'm a very direct communicator, and sometimes being direct can come off as being aggressive or rude or bitchy. I don't know if I can say that, but
we can say whatever we want.
Yeah. And mainly because I'm just not one to beat around the bush. If I need to say something, I try to just be as direct as possible in my communication. And the person on the other line took it very personally and ended up hanging up on me and they're reporting me. And the whole situation was then diffused by my male attending later, who had to like go onto the unit and give like an educational talk about why I had answered the way that I answered, like why we couldn't do this thing that they were requesting. Basically repeating everything I just said, but doing it, I don't know, in a place of more leadership because he's my attending. And I mean, that situation taught me a lot. One, maybe my direct communication isn't going to come off and get to people in the way that I think that it is. But sometimes like I feel like I need to stand my ground and not, this is the decision that I want to make, and I just have to stand my ground. So yeah, I feel like I have very mixed experiences with that. As a nurse, I felt like a lot of camaraderie. As a physician now, like sometimes I feel a little more friction.
Yeah, I totally get that. I think in general, where I trained, it was like pretty easy peasy, vanilla. There were some times where it was like frictiony. And I know that, so we met at a dinner not too long ago. And I think we were chatting about like a lot of times we don't appreciate what the other is doing. And I think being a nurse, now becoming a physician, you have such a unique insight into that. So, like, for example, in medical school, perhaps, or as an intern, perhaps it would have been good for me to do like an 8-hour shift with the med surge floor nurse, because then it gives me a sense of like all the shit they have to do all day. Like they have like 6 patients, taking report, giving report, passing out meds, discharging people, accepting transfers onto the floor, like assisting with your friend or like your colleagues' patients when they're at lunch. I just feel like when I was rounding as a resident and we had put in an order like several hours before, I'm like, why wasn't this done? Why wasn't this done? Why wasn't this done? Where
Yes.
it's like, oh, I need to have an appreciation of like everything that nurse did for the last few hours. Like she may have not even known I put in that order. And then on the flip side, what's interesting is like a couple of the girls that work here with me, they were asking the other day, like, so how long is residency? Like, what do you do as a resident? Like, they didn't know that we don't learn how to like put in an order. And so then conversely, I think like maybe it would be helpful for newly minted nurses, especially those that work in academic centers, to like somewhat get a brief rundown of like how dumb we are when we start out as interns. I don't know. Do you have any thoughts on that?
Yeah, I mean, being on both sides of the coin, having my experience as a nurse and starting as a resident. The hard thing is because I was a nurse for 5 years, I almost came into it with a higher expectation for nurses, because I went into it like I worked really hard as a nurse, and so I expect nurses to do the same. So I had this higher expectation for them. Like if I am putting in these orders, I hope they see them and, go through with them. So I was kind of adjusting with that, as well as trying to adjust to being an intern, which is a whole different thing. I do think that having my nursing background helped me as an intern, though, because I am just more familiar with how hospital systems are run, how to communicate with nurses, even understanding when to time medications to make it easier for nurses to pass out those medications. So I do think that my nursing background kind of helped make me a strong intern because of that, just like understanding how to figure all of that out, and even dosing wise with medications and timing medications, putting in certain things like, delirium precautions. I remember being in my internal medicine rotation and just thinking like, we have this list of mostly geriatric patients, and why are they not all on delirium precautions? Because as a nurse, I'm not going to want this patient to sundown while I'm on my shift. So as the intern, I was like making sure that I had nightly meds that the nurses can go to if anything were to happen. So
yeah, you had
like
the practical. You had the practical background that helped you with all of that. Do you have a sense that what career direction do you want to take in radiology?
Yes. So I do have a sense, and it's one of those things, it brings me back to patient facing. So after just like these 2.5 months of training, I know that I want to work with people. So radiology does allow that in a couple of aspects. Breast radiology is one of them. And honestly, like body radiology, doing abdomen imaging, you can do a lot of like biopsies, and then interventional radiology. So I definitely want to do something that involves procedures. I am leaning more towards breast radiology. One, because the demographic, I think that I will connect with strongly. I think it's a very sensitive specialty to be able to communicate results to patients and work with them, as well as the interdisciplinary team of breast surgeons and oncologists. So I'm kind of leaning more towards that. Sometimes I get a little anxious thinking about it because radiology is 4 years of training beyond my intern year, plus a year of fellowship. And so it gets me anxious to think that I'm going to train for 5 or 6 years and then just do breast, which is literally such a small part of anatomy. And like, am I going to do all of this training to do such a small part of the body? Am I okay with that? So I'm trying to consider if I want to do breast or like a mix of breast and body. So I have time to think about it, but that's kind of where I'm leaning.
Yeah. I say I very niche. So I did,
Yes.
6 years of surgical training after medical school, head and neck surgery, then facial plastics. And now I only do cosmetic surgery of the face. And even then there are things that I don't like doing, so I don't do them. So most of my weeks are filled with facelifts. And it's like, wow, I did all this training to basically do one surgery, but I love being niche in what I do. And I think there's such like an art and creativity component that even though I'm doing like very similar procedures on each patient, the procedures themselves vary quite a bit.
Right. I actually love that. I love the idea of being like the ultra expert of this thing that you do. And yeah, so we'll see. I mean, we'll see where I end up, right? Because it can change. We have to decide as far as applying to fellowship in our 3rd year. So I have some time to.
Plenty of time.
Yeah.
One question that's been kind of swimming around in all industries is how will AI or artificial intelligence impact our industry? I listen to tons of marketing stuff because I own my own business. And so it's really interesting to hear people talk about like how AI is going to integrate and make marketing better. Have you guys started to talk about integrating and kind of what the future looks like specifically for radiology and AI?
Absolutely. We just had some conversations about this week. Right now, I'm on an ultrasound rotation. So anything in the abdomen that we ultrasound, right upper quadrant, stuff like that. And we are so excited to have AI more integrated in what we do. At this time, my program doesn't have that many AI integrations in rotations that are outside of breast. So everything that we measure on imaging, we do ourselves manually. We would love for AI to do that for us because it's very tedious. When you are measuring, say, lung nodules or any lesions that you see in the liver. These are things that we cannot wait for AI to help us with. And I get a lot of, because I'm also on social media, I get a lot of comments about AI taking over my job. And it's so far from the truth for radiology right now because we are excited about AI. We cannot wait to integrate it in what we do to make our job easier because the volume of imaging just increases constantly. And we are not graduating enough radiologists to keep up with the volume. Like I said, our neuroradiology list is 800 studies long. How do we catch up with that? We need help. And AI will help us right now. In some capacities, it does pretty well, but mostly you need a trained eye to make final calls.
For sure. An existential question I was kind of chomping on this week was, and I don't know why I'm bringing this up with you. I get the sense that you have very high standards for yourself and others. The question I started to ask myself this week is like, what is the difference between being good at something and being truly great at something. We could argue that you strive to be a great nurse. Right now, you are learning to be a good, safe radiologist. Thoughts on good to great?
Yeah. I that's an interesting question. Honestly, for me, I think it's about consistency. I think as long as you show up, be consistent for radiology, we get a lot of comments that radiology residency is very chill. You work 8 hours, you go home. But to be a great radiologist, you need to study. You need to keep up with all the new pathologies. You need to keep up with the technology, and be consistent with showing up and studying. For me, I'm like I'm trying to survive right now, and trying to do my best. But what I've kind of a goal that I've made for myself is, as long as I can read on one topic per day, maybe it will help mold me into a great radiologist. And as long as you're, being consistent, showing up, and working hard.
Yeah, I think that's a really good practical tip for trainees, like med students, residents, fellows. I tried to read 15 minutes a day, which sounds so minuscule compared to medical school, but residency, you're also learning on the job a lot.
Exactly.
Okay, you recently posted something fun on TikTok about how to rage bait an RN to MD. I want to run through these, and I want you to give me some responses to these negative comments that you commonly see. So why didn't you just become an NP? That'd be less debt.
Oh, I get this so much. Why would I want to go to medical school? It's like hundreds of thousands. Some people say you'll be $500,000 in debt. Sometimes it's just overly exaggerated. People never talk about the scholarships that are available for medical students.
Yeah.
I think people just don't know about it. So yes, we are all in debt.
So someone comes up to you on the street and says, "Oh, you couldn't handle bedside anymore?" What's your response?
Honestly, that's probably a little true.
Okay, how about doctors don't work as hard as nurses?
Try being an internal medicine resident for a day, or a general surgery resident for a day.
Okay, this is the flip. Doctors work too much.
I would say residents work too much. I mean, it's funny because it's rage bait, because some of it is true.
I know. You only did it for the paycheck.
Honestly, you can choose a profession outside of medicine, make more in less time.
Finance. Oh my gosh. I feel like, that would have been a better financial choice than medical school.
Absolutely.
Wow. You really switched teams, Lily.
We're all on the same team.
Oh, I love that. Also, I should call you Dr. Nguyen. Don't you miss your 3 12-hour shifts?
Yes, I do. Don't remind me. I always get reminded of that.
Yeah. Okay. So those were very accurate rage bait comments that you posted, because there's definitely some truth to them.
There's truth to them, and it's just like, it's not helpful to hear.
Yeah, for sure. Well, you mentioned in a post that you created kind of a guide for RNs to MDs. Tell us a little bit more about some of the resources that you have available if anyone listening is interested in learning more about that path.
Absolutely. I wrote this RN to MD guide my intern year. That's because, one, I finally got my MD and I felt like I had the credentials to be able to speak on it. And two, because when I was going through the entire pre-med process as a non-traditional RN with 10,000 clinical hours of experience, I felt like I could leverage that so well. How could I leverage all of this clinical background to get into medical school? And I looked online all over the place, and I felt like there was a lot of information for traditional students going to medical school, but not for people with strong clinical backgrounds. So I sat down and I wrote this out during my intern year, and 400 people have gotten a hold of it. And I think it's been a great roadmap for people with clinical background and teaching them how to leverage their clinical background to create a strong medical school application. That guide is available. I also have, like, even if you're not a nurse, I have a guide that's very similar that's for non-traditional people with clinical background. Say if you're a radiology tech or an EMT, that's also available for people. People can also book a one-on-one consultation with me. I have a booking that's at a premium because I value my time. So I always tell people the book will answer all of your questions. And then if you want very personalized one-on-one time with me, you can book that as well.
I love that. And I would argue, like, I've never been on a med school admissions committee, but anyone with a big clinical background, like you mentioned, like EMTs, RNs, I would say they're probably better applicants because they know what they're getting into. Whereas
Exactly.
dummy old me over here, I was like, yeah, med school sounds really cool and interesting and challenging. Let's do that. Well, I had never really like worked inside of a hospital before, so I didn't really know what I was getting into. Luckily, I enjoyed it and still enjoy it. Okay, so you survived. You survived your intern year. You're on to your R1 year. Let's close out by giving all the current interns right now who are just struggling and drinking from that fire hose, give them one piece of advice for their next 10 months.
Don't be so hard on yourself. Intern year is not meant to be easy. You learn on the job. Don't be so hard on yourself. Your job is to learn and just embrace that.
Yeah, a little self-compassion. I love that.
Exactly.
Well, Dr. Lily Nguyen, thank you so much for being on FemMD. I hope that you have an excellent rest of your day and an even better rest of your R1 year.
Thank you so much for having me. I really appreciate it.
Thanks for tuning into FemMD. And remember, the world belongs to the women who question it. This show is brought to you by the Hippocratic Collective. Check out our shows and content at hippocratic-collective.com.